the difference between pain and dysfunction? That's the subject of this video. Hi, I'm Dr. Shaki from Irvine Spine and Wellness Center, your Irvine Chiropractic and Posture Clinic. Stay tuned. All right, so this is such a huge problem I'm having, and I'm sure all the other offices are having. You have to understand the difference between pain and dysfunction. Not every dysfunction immediately causes pain, and not every issue comes with pain. If you think about, for instance, diabetes, you think about hypertension, you can think about cancer as an example. They don't come with pain. So just because you don't have pain does not mean everything is great. Now, if we're looking, when it comes to musculoskeletal conditions, when we're looking at function versus dysfunction, if you have dysfunction, you have a problem, even though you may not be experiencing pain necessarily right away. It's only a matter of time. So dysfunction means instead of moving your body based on the design that you're born with, and yes, you are born with that. That's a default that we all have. That's because if you think about it, all babies move the same way. They go through the same developmental stages. Those developmental stages also carry with them the neurology that goes with the movement. So we all automatically, as babies, follow the same pattern, and that's because we're born that way. It's within us. It's like your iPhone or your cell phone, I should say, which you can delete all the apps, and it's still certain apps that you cannot delete. It's part of your phone. So when we follow the patterns of movement, the synchrony of movement, the progression of what comes after what, which is based on what our body innately knows, we follow the function. That's the biological function. When we go against that for one reason or another, not that it's a decision you make, but that's the best thing your brain can do given what you throw at it, given what kinds of tools you have in the toolbox. So when you follow that and there's a modification of the movement based on your injuries, lifestyle, habits, choices that you make, which you may not be aware of, but you are making, your brain has to modify things based, again, on what you throw at it. So the dysfunction happens. We call that pathological patterns of movement. So when dysfunction happens, the decline in movement takes place. And as a result of decline comes the decrease in movement, increase in structural integrity of your body, and as a decline happens down the road, pain will happen. So there's a lot that happens before the pain comes, and if you're looking for pain because somehow pain came and then it went away, so everything must be okay, you're mistaken. So I just had to do this video because it's so crucial for you to understand the difference. And if you have pain and then the pain goes away, don't think your problem has gone away. It's just temporary. At any rate, if you like what you see, please subscribe to the channel. You can contact me through one of the methods of contact in the description box. And until next time, take care.